The best type of patients who are good candidates for spinal fusions are people who have conditions that cause pain from things like spondylolisthesis or instability, or if they've had previous surgery where the previous surgery resulted in certain problems where they have persistent pain. And then there are even more clear reasons for fusions in people who have certain types of injuries, fractures or ligament injuries. And then there are the more rare reasons to do a fusion. For example, I had a young man who fell out of a two-story window and broke his back. That obviously doesn't happen too often, but that definitely needs a spinal fusion. And occasionally I'll see patients even with certain kind of tumors or infections where in order to clean out the infection, the vertebra needs to be removed and fused. Yeah, so I try to be very open with the patient as to exactly what their problem is and how it needs to be fixed. And so when a patient who has no medical knowledge is being told that they'll need to have bone marrow taken from their hip and then there'll be a centrifuge in the room to get bone graft and there's cadaver bone and there'll be screws, and that's a very overwhelming set of information that is given to the patient. So my feeling is when a patient gets that kind of information, if they don't really have a problem that's significant, usually they're like, well, I can live with my pain. So I try to be very clear as to what exactly is going to happen in the surgery so that the patient is informed and understands what they're getting into. So unfortunately, there are lots of conditions that cause severe pain where the patient is miserable. They can't live and function. And so despite hearing all that scary sounding terminology, they want to go ahead and proceed with the surgery because they can't live the way they are.